Good morning, good evening, good afternoon, all around the globe. Welcome you to IASRM, dear friends and colleague, International Association of Stem Cell and Regenerative Medicine. Many of the times you ask me or our team what you are going to learn in the one-year fellowship in Stem Cell and Regenerative Medicine. As I told in my previous video or the learning platform, it's categorized in 4 parts: theoretical lectures online, practical and hands-on training for 5 to 7 days, and thesis work and the online examinations. So during the theoretical lectures and the practical demonstrations, let's talk what you are going to learn. The theoretical recent advances from the basics of stem cells, regenerative medicine, cellular therapies, tissue engineering, immunotherapies, these all you are going to learn in the theoretical aspects. So the practical learning during the fellowship of stem cell and regenerative medicines, you are going to learn how to prepare platelet-rich plasma, platelet-rich fibrin, among platelet-rich plasma, high leukocyte, low leukocytes, which kind of anticoagulants, what should be the temperature, many recent advances. Then you will also learn BMAC, bone marrow aspirated concentrate, hematopoietic stem cells, then fat grafting. Among fat grafting, microfat, macrofat, nanofat, stromal vascular fractions, mesenchymal stem cells, exosome therapies, then liposomes, secretomes, some perinatal biologics factor like cord blood banking, Wharton jelly, amniotic membrane, amniotic fluid, placental extract. This all you are going to learn during that, and some other advances like dental pulp stem cells, then maybe some genome editing tools we are going to cover, and then induced pluripotent stem cells, CAR T therapy, chimeric antigen receptor T cell engineering, zinc finger technologies, CRISPR-Cas technologies, how to set up cell culture and stem cells laboratory, regulatory guidelines from all around the world, ethical requirements, how to do the clinical trials, pilot studies, publications, research grant writing, patents, trademarks, commercialization, intellectual property and funding. So these all aspects you are going to learn during this course of the Regenerative Medicine Fellowship. In clinical aspects, it's a specialty wise one-to-one lecture with world leading experts. If you are orthopedic surgeon, you are going to learn how regenerative medicine contributing advances in orthopedics and the sports injuries like osteochondral desiccants, any full thickness articular cartilage damages like from the ORS to BMP to autologous chondrocyte implantation to PRP, BMAC, SVF, mesenchymal stem cells, many other advances, pain management part, spinal cord injuries, avascular necrosis, plantar fasciitis, rotator cuff, tennis elbow. So these all area you are going to see how stem cells and regenerative medicine making advances this science. If you are a OB/GYN or infertility or reproductive medicine specialist, you are going to learn 3 aspects into that. Definitely the infertility indications like thin endometrium, Asherman syndrome, primary ovarian insufficiency or premature ovarian failure, oligospermia or non-obstructive azoospermia, erectile dysfunction, and the aesthetic aspects. If you are going to learn with some energy based devices like laser, radio frequency, and HIFU, high intensity focused ultrasound, high FEM technologies for pelvis floor management, and many other indications like stress urinary incontinence, vaginal atrophy, interstitial cystitis, overactive bladder. So these kind of indications you are going to learn in OB/GYN areas. Then regenerative medicine in aesthetic and plastic surgery, oral maxillofacial surgery, many indications like submucosal fibrosis, lichen planus, and other areas, some recent advances in metabolic disorders like Crohn's, IBS, IBD, diabetes, liver cirrhosis. So these how regenerative medicine making advances in this all field. Non-healing ulcers, wound care management, critical limb ischemia, peripheral vascular disease, peripheral arterial disease, definitely the aesthetics or androgenic alopecia areata, skin rejuvenations, striae, stretch marks. So amalgamation of clinical, academic, and the research oriented learning during this fellowship course. And apart from that, It's not our relationship is going to end. We support you with the setup of your facility. If you want to pursue as a regenerative medicine as your practice or the career, will definitely help you or give you some separate consultation if you require. So looking forward to see you in a great learning with world leaders in stem cell and regenerative medicine. Thank you, my friends.